the quick take on things that you need to see for staging renal masses. So this patient has renal cell carcinoma. The first thing you want to see is the size of the tumor. The size of the tumor is best measured on the excretory phase images because you can see the parenchyma and the mass separately. Right? The second thing to see is if there is any extrarenal extension, that is extension into the perinephric fat or into the renal sinus fat. These are quite difficult to be certain about. A little bit of irregularity usually doesn't mean anything. And also, if there is bulging of the mass into the renal sinus fat or renal calyces, that generally does not mean that there is invasion, but it is useful to mention this in your reports. After that, you want to see also if there is any renal venous thrombosis. So you can go, and this is the corticomedullary phase. You can see the renal vein here, and you carefully look at all the veins, particularly the ones which is supplying or draining the tumor. And in this, you can see the attenuation of this vein is slightly different to the attenuation of the other branches, suspecting tumor. And you can confirm that in the delayed phase imaging, where you can see that there is a tumor thrombus in the renal vein. So now you have upgraded this tumor from a potential T1 to a T3A tumor. The next thing that you want to see is account for all the other renal lesions and make sure there are no other enhancing lesions. For example, there's a cyst, another low attenuation lesion here which is a cyst, contralateral kidney as well, probably a cyst, and so on and so forth. Last but not the least, you want to make sure that there are not any renal vascular anomalies, i.e. accessory renal arteries. For example, this patient has a single renal artery. You confirm that using the coronal reconstructions. Here it is a single ostia, and also there are no circumaortic or retroaortic renal veins.